It's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with news about the pneumonia vaccine. Hello, Linord.
Médecins Sans Frontières has delivered a petition with hundreds of thousands of signatures to Pfizer, urging the pharmaceutical giant to slash the price of its pneumonia vaccine for poor children. MSF says many regions of the world cannot afford to vaccinate children against the disease, the acute respiratory infection, which costs about $10 for the Pfizer vaccine and comes in 3 doses. The same request was made to GlaxoSmithKline. GSK's vaccine cost about $9. MSF and its supporters want those prices cut roughly by half in all developing nations and for humanitarian groups. Pneumonia accounts for 15% of all deaths of children under 5 years old. Now, the World Health Organization is calling on countries to reach more children missed by routine vaccine delivery systems, including children in conflict zones. April 24 to 30th is World Immunization Week, marked every year during the last week of April. The World Health Organization says more than 60% of children who are unvaccinated live in 10 countries, including the Democratic Republic of Congo, Ethiopia, India, and the Philippines. Jean-Marie Okwobele is director of the Department of Immunization, Vaccines and Biologicals with the World Health Organization.
Today, we estimate that there are about 15 to 20% of children who are not receiving their immunization. And they live in countries with conflicts. They live in countries where we have weak health services. They live in countries where, vaccines are not readily affordable so that they all can get them.
The WHO has outlined further steps countries can take to close the immunization gap and meet global vaccination targets by 2020.
In terms of the final benefits that we want to see for immunization, in other words, 100% coverage is what is required so that we can make sure that the disease transmission is interrupted nearly everywhere worldwide.
In 2012, the World Health Assembly endorsed the Global Vaccine Action Plan, a commitment to ensure that no one misses out on viral immunizations.
Despite all the efforts, we really need to close the gap on immunization coverage. As of today, 1 child out of 5 still miss in basic immunization coverage. And that leads to a significant number of deaths that can be prevented for diseases like pneumonia, diarrhea, diphtheria, tetanus, very simple and basic diseases for which we have an immunization that can prevent them.
The WHO says only 1 out of 6 targets is on track: the introduction of new or underutilized vaccines in low and middle income countries. Joining us in the studio for more on the pneumonia vaccine and Immunization Week is Robert Steinglass, the Immunization Technical Advisor for USAID's Flagship Maternal and Child Survival Program, JSI. Mr. Steinglass, welcome to Africa 54.
Thank you for having me.
So MSF is advocating to have the cost of the pneumonia vaccine cut in half, and 15% of children under 5 are dying from pneumonia alone. Is the cost of the vaccine one of the main reasons why so many children are dying?
It's one of the reasons, and of course, if the price of the vaccine comes down, it means with the same fixed amount of investment in vaccines, you can immunize more children. So I think it's a good thing to try to drive the price down as much as possible. At the same time, you want the vaccine industry to continue to participate in the programs. You don't want to scare all of the manufacturers away. So there's a fine balance and a dance that takes place, but the vaccines do need to come down. I think the manufacturers have already recovered most of their investment costs on some of these vaccines.
Okay, interesting. Now, what do you make of the immunization gap that we are seeing?
Well, the children in the world are being reached at about 80% coverage levels in most countries, most regions. So that's a huge success story. And because we've been so successful, it's naturally time that we turn our attention to figure out how to reach the missing children. UNICEF calls them the 5th child, the last 20% of children. And there are many reasons why those children aren't being reached. Of course, cost of vaccine is one, but it's probably not even the most important reason.
Okay, what would you say is one of the most important reasons?
Well, in many countries, the health system as a whole isn't terribly well developed, including in parts of Africa and parts of Asia. And the immunization program is part of the health system. So if the health system isn't strong, if health facilities aren't present, if health workers aren't being trained, and if health posts aren't being staffed, these are other important reasons why kids aren't being reached. Also, the last 20% of the kids are going to be always the most difficult to reach. They're going to be living in remote areas, urban slums. They're sometimes marginalized populations. So it's sometimes simply more difficult to reach those remaining kids.
Mm-hmm. Now, this past February, there was a major conference on vaccination in Africa, the ministerial conference, which you took part in. And what were some of the planning in terms of what's ahead for immunization in Africa? What were some of the discussion points and resolutions that were put?
Right. Well, first of all, this was an unusual conference in many ways. It was the first time that ministers of health, the people in charge of the health programs in these countries, were at the same meeting with ministers of finance. And of course, those are the people who control the money.
Absolutely.
As well as ministers of education in some cases. And I think all countries in Africa were represented. So it was a very high visibility political occasion to explain to ministers of finance why investments in health and particularly in immunization is such a good buy and why there's such a big bang for the buck. So the ministers of finance heard how if you even invest $1 in immunization, the return on investment, which is of course what motivates them, is about $16. It's what my grandmother used to tell me. She used to say an ounce of prevention is worth a pound of cure. Absolutely. It's the same 1:16 ratio. Okay. So I think the ministers became aware of the importance of immunization and the need to invest their own resources. The governments need to also step up to the plate and invest their own resources. And I think they heard that message loud and clear.
And in 5 seconds, what's the takeaway for this World Immunization Week?
Well, we've got to continue to invest in immunization. Kids are being born all the time. We can't lower our guard. We've got to do a better job.
Thank you so much. It's good to have you here.
Thank you very much.
Thank you. And that was Robert Steinglass. He's the Immunization Technical Advisor for USAID's Flagship Maternal and Child Survival Program, JSI. And that's our health report for today. To stay in touch for more health news, find me on Twitter at Linord Moudou. Vincent?
Well, thanks a lot, Linord. And be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.